Alrighty, so today I'm going to be assessing a vein and selecting an appropriate vein for intravenous therapy on my lovely volunteer, Chris, here. And before we begin, I would be looking in his chart for any indicators that may help narrow down the IV selection, such as has the patient had a mastectomy, has a patient had a stroke, has a patient had paralysis or dialysis shunt, and I would be wanting to make sure that I was selecting the opposite extremity. My patient doesn't have any current medical history that matches this. So as usual, I would go into the room and introduce myself, check for my 2 patient identifiers, and I would be making sure I was explaining the purpose of the intravenous therapy and the process for which we are going to do that. So I would have already primed my IV tubing at this point, and I would make sure that I had, performed hand hygiene, applied a fresh pair of gloves, and at this point I would begin to assess for the vein. And we're going to be wanting to avoid areas that would interfere with my patient's activities of daily living. So I would ask my patient, what is your dominant hand?
Left-handed.
Your left hand? Okay, so we are going to select a IV insertion site on his right arm here. So I'm just going to take a look at your arm now, and I'm going to be looking for any areas of erythema. Is there any tenderness when I press down anywhere? I'm going to be looking for any areas of infection. Alrighty, we're going to be avoiding any sites that are distal to a previous venous puncture site, that are distal to any sclerosed veins or phlebitic vessels or areas of infiltration. And I'm looking on his arm and I can't see any areas of redness, tenderness. The patient's reported no pain. And I'm really going to be wanting to hit those large veins, so those basilic, cephalic vein. So I'm going to apply at this point, I'm going to apply my tourniquet flat. Okay. And you can kind of promote vein distension to select your veins by having the patient place their hand in a dependent position and maybe even asking them to flex their fingers. And I'm going to be stroking down from a distal to proximal, just kind of below where I think would be my proposed site here. And I'm going to press down with my index finger here and note that soft, bouncy feeling of his vein here. So at this point, I've confirmed where I find that an arm that won't interfere with his activities of daily living. And while I see this median cubital vein right here, I'm going to avoid that because it's kind of right in the crook, and I want to be making sure that I'm allowing my patient to be the most independent as possible. So I'm noting that soft, bouncy feeling, and this is where I believe I am going to continue with inserting my IV. And we are done assessing the vein at this point, and I would take the tourniquet off and continue with my IV preparation.